Hospitals across England about to run out of supplies of protective equipment.
The Covid-19 pandemic has claimed the lives of yet more NHS workers.
Every hospital trust was advised to risk assess Black and Asian staff.
Some have done barely any assessments.
Stress, exhaustion.
They are at breaking point. They are struggling mentally.
In the darkest days of Covid, amidst the panic and the death, there was also failure. It may seem like light years away for some, but for others, they don't need a reminder of how shockingly bad it was.
There are things I've seen and witnessed that I don't want to see again.
There was this general fear that some of us are going to catch this and some of us might not survive.
ITV News can exclusively reveal some of the evidence doctors will put to the Covid inquiry. The British Medical Association has shown us detailed accounts of what it was like to work in hospitals on the front line at the time. And it isn't good.
This first report details how well protected the medical profession was from Covid. The overwhelming view is that they simply weren't. One writes that healthcare workers died due to insufficient PPE, and it concludes they were systematically exposed without being able to mitigate the risks. The government, it says, did not act quickly enough.
Dr. Ford Dunn is a palliative care consultant.
I felt angry that I was being put in this position.
Today, reflecting on the pandemic, she believes the government deliberately weakened safety standards.
We knew we were up very close to patients with Covid wearing what didn't seem like adequate PPE. It seemed like guidance had been written according to what might be available. When deliveries did arrive, often the PPE wasn't fit for purpose.
Would you say then that the government's culpable for many of the illnesses and deaths within the profession?
I think there's a lot to be answered.
As the pandemic went on, the government did ask hospitals to assess the risk to their Black and Asian staff.
The evidence here claims that by May 2020, a whopping 64% of doctors had still not been risk assessed, despite evidence that staff from ethnic minority backgrounds were dying in the greatest numbers. Nearly half of the respondents from such groups said the assessments were either mostly or completely ineffective.
Consultant radiologist Dr. Anil Jain agrees. He remembers the height of the first wave vividly.
95% doctors who died were BAME doctors.
You lost two uncles?
Yes.
To Covid?
Yes.
As he looks back at those he lost, he questions why action to protect colleagues here stalled.
The risk assessment hadn't been carried out on staff, so they were ill-prepared, and that led to the neglect that doctors from ethnic minority.
Were you frightened?
I was completely scared,
The second report exposes the chronic lack of staff. It says the medical profession were too often exposed, suggesting not all deaths were inevitable. The inquiry will also hear, had the health service been better staffed going into the pandemic, it's possible deaths within the profession would have been lower.
It's something that haunts emergency medicine consultant Dr. Denise Langor.
You had this awful decision of, do I have to say to them, you're going to have to do a little bit because there just aren't enough people here.
She recalls staff pleading with her not to work on the Covid wards and having no choice but to send them in again and again.
We pulled staff from everywhere. We cancelled everything. And people have suffered from that. We were always very conscious not to send vulnerable staff members into the Covid areas. But what that meant was that the staff that were safe to work in there were sometimes put in the position where they were in there for far longer than they reasonably should have been.
The BMA concludes the government failed in its duty of care to protect doctors and healthcare workers. It will, of course, be up to the inquiry chair to decide whether that really was the case. Emily Morgan, ITV News.